We are live. We are live. Hello, and good evening, everyone, and welcome to another segment of Awareness Wednesday Prime Time. We are your host, Reggie and Victoria Flanagan, here in New Jersey. So welcome, everyone who's connected via Zoom as well, Facebook as well, Facebook Live. So we are connected, all right? So let's get our platform started. Before I get into the detailed information of what we're going to be speaking on, I'm going to pass this platform over to my better 7/8, Mrs. Victoria Flanagan, our certified health coach, who's going to give information on why this is important to her, this platform we call Awareness Wednesday. Victoria, take it away.
It's just about keeping people aware of what is going on out here. I don't know everything, family, but I'm a researcher. I will find it.
And that she is. She is definitely a researcher. So let's get started. There's so much, going around our country, around the world: high blood pressure, diabetes, cancer, obesity. Now, this is Men's Health Month. There are so many things that are happening about these different issues, and all of them are on the rise. The numbers are climbing. Every last one of them are climbing. It makes you wonder what is going on, what's happening. But, what industry? What is it? The food? What is it? Is it in the air? We have no clue. It could be a combination of everything. All I know is that we need to take better care of our bodies. The temples need to be well taken care of. The immune systems out here are compromised. They're very weak, so it is susceptible to catching anything, diseases, colds, everything you name it, we're catching it. So we got to figure out a way to make it better and get ourselves stronger and become more efficient in taking care of the body, period. All right? So let's go on to our topic, which is serving God with healthy mind, body, and spirit. And our scripture, as always, what's our scripture?
3 John 1 and 2.
Exactly. 3 John 1 and 2. All right, so that is the scripture. Let's get this platform started. We're going to talk about prostate cancer today. Prostate cancer, all right? Who do you know that may have this issue? You never know, but there's so many of them. Look at the numbers, staggering. 313,000 new cases diagnosed this year.
Yes.
That's huge numbers, all right? So before we do that, let's go into our disclaimer that we do have to read every segment. The Power Cup of Health. This program offers health and nutritional information and is designed for educational purposes only. You should not rely on this information as a substitute for, nor does it replace professional medical or psychological advice, diagnosis, or treatment. None of the statements made have been reviewed or approved by the FDA, Food and Drug Administration. We are going to speak about a few products as well, nutritional products, and we do have a disclaimer for that as well. The products that are going to speak about have not been evaluated by the U.S. Food and Drug Administration and not designed to treat, mitigate, or cure any types of disease. But all we do know, by our opinion, we do have the best products on the market today. That's our opinion. So with that being said, I'm going to pass it again over to the urgent certified health coach on this platform we call Awareness Wednesday. Victoria Flanagan, the floor is yours. Let's go about prostate cancer.
Thank you very much.
You're
I'm
very,
posting
very
it
welcome.
up on the front of my page
Let me make sure it's up
in
here
case
too.
everybody just pops in and want to know what they're talking about tonight. Well, I'm glad you asked because I just posted it right on up there. Yes, June is Men's Month, and we got to take care of our men. I want to take care of my man, and I hope you will want to take
Thank you
care
very
of
much.
yours as well. But you gotta wake up. We know they can be hard-headed at times. They don't always take care of their health the way we want to. But ladies, you have to listen. Listen for those little things. Listen for what he's not saying. Paying attention to his habits and things like that. Just find out what's going on with him. If you gotta follow or listen through the door in the bathroom, you gotta do what you gotta do. But that's why we chose prostate cancer. What is prostate cancer? It is the most common cancer found only in men. This is the second most common non-skin cancer diagnosed in America. The American Cancer Society estimates that nearly 313,000 men will be diagnosed this year with prostate cancer. This is just June, y'all. This is half of the year.
This year.
313,000. Is your man one of them? Is your brother? Is your father? Come on, we got to wake up, family. Truly got to wake up. That's how many are going to be diagnosed in 2026. So despite the increase in screening and the steady declining in the numbers of prostate cancer deaths over the years, prostate cancer is still the second leading cause of death in America in men. And I pulled up the stats right here. It says it's 1 in 8 men.
Will be
1 in 8
diagnosed.
will be diagnosed. This year, 313,000 will be diagnosed this year. It also states the demographic, racial, and ethnic disparities remain significant. Black men have incidence rates of 67% higher than white men. Mortality rates twice as high. Black men. See why we got to pay attention? We have to pay attention to what's going on, family. If we just do. We just do. It's still the second leading cause of cancer in men, prostate cancer.
Second leading.
Second leading, right behind cardiovascular disease. So it also states what causes prostate cancer. I got it. Prostate cancer is a walnut-sized gland located below the bladder and in front of the rectum. It surrounds the urethra and it produces a substance that contributes to semen, the fluid that carries sperm from the testicles. So most cases of prostate cancer, 99% are adenocarcinoma, which develops when gland cells mutate and grow out of control, forming a tumor that can metastasize to other parts of the body. Other parts of the body, including most often the bladder, the rectum, and the bones of the pelvis. So if you don't catch it in time, that's how men get caught up, because it starts to spread and metastasize.
At that point, it's too late.
Jill Biden talked about Joe Biden's prostate cancer just yesterday on The View, that with his doctors and all his professional doctors that they have, I mean, the top of the line for the president of the United States, and they didn't test him for that. And then when he did find out, he's stage 4 prostate cancer. So whether or not get tested, just get tested. Who gets prostate cancer? It is rarely diagnosed in men younger than 40, but the numbers are changing. Since by the age of 50, it is common for men to experience changes in the size and shape of the cells in the prostate. Understanding whether these changes are signs of prostate tumors or knowing your risk for developing prostate cancer are important steps to protection of your health. According to the National Cancer Institute, the average age a man is diagnosed is in his 50s. The average age a man dies of prostate is in his 80s. Now, pulled up the stats. Where's that one? The age groups. Here it is right here. It says prostate cancer risk increases with age. The most diagnosed occurring in men age 55, but we know that that number is getting lower. And the highest death rates among men age 75 and 84. It states that you can get it as early age as 45. 45 to 54, you have a 5% chance of getting it. 5% of the cases, age 45 to 54. The next age group is 55 to 69. You have a 52% of the cases of prostate cancer. Then the age 70 and older, you have a 43% chance of prostate cancer. So it gotta, you gotta follow your age range. You gotta know your history in your family.
Yeah.
If your father had it, your brother had it, your uncle had it, you gotta follow that narrative and follow the history in your family. So men whose father and brother, run right into it. The men, the father and brothers who had prostate cancer are twice as likely to develop it, because it's in the genes.
Yeah, hereditary.
But genes can also be diminished.
Altered.
It can be hereditary, or you can break that cycle. It can skip a generation, and you know how that goes. So here's some signs and symptoms of prostate cancer. We had a young man on this morning, that's Pastor Massey. He was saying he didn't have any signs. So you still have to know your body, because your body's talking to you always. So the signs may differ from each man. So again, you have to know your body. So early warning signs: a need to urinate frequently, especially at night. That's why I was saying, ladies, You might have to listen to the door. If he got out of the bed, he's going to the bathroom.
Hmm.
How many times did he get up? Or is he standing in the bathroom too long? Is it stopping? Is it starting? You got to pay attention and you got to listen because he's not going to tell you everything. The next one is difficulty starting and stopping the stream of your urine.
Exactly. Let me just touch on that. And
Of
I learned
course.
about that part right there. That as men, to see if your prostate's healthy, when you're urinating, see if you can cut it off at midstream, and then release the pressure so that you can get that good natural flow. Do that a couple of times. It's sort of like the kegling move that they speak about.
Strengthening those muscles that you
around
don't
it.
usually use.
So if you can't do that, then you may have an issue with your prostate. I press upon you to get yourself checked out.
The next one is a loss of bladder control. You might wind up skeeting or peeing a little bit. The next one is burning or pain during urination. If you're standing there and it's burning and you don't want to pee, you don't want to let it out, and it's burning and it's painful, you might want to get to the doctors.
Mm-hmm.
The next one is blood in the urine or in the semen. If you see any kind of blood, or if it's pink, pink is just a sign that blood is somewhere in there.
Yes.
So pay attention to all these little signs. The next one is leaking of urine when laughing or coughing. Like I said this morning, it's not just ladies that skeet when they laugh.
Mm-hmm.
Men do too, y'all. Men do too. If they can leak urine while laughing or coughing,
Mm-hmm.
pay attention. Did he wet his pants? Did he not shake himself well when he come out the bathroom? Just these little things, because he's not going to tell you. Men are very private when it comes to things like that, but they shouldn't be. It's 2026. Nothing else is off the grid, so you should be able to talk about that too. But men don't.
So, like she mentioned in the beginning, keep an eye on your men folk. Keep an eye on them, because you never know. They might not even know.
Exactly.
They may think it's normal of what they're going through right now. They might not know, but you may recognize the symptoms. Hey, you might want to ask.
So the next one is difficulty getting an erection. That's ED. And I did the report on erectile dysfunction. ED stands for early death, because that means you're not getting enough flow of blood down there. You're not getting enough flow of blood everywhere. So you got to pay attention to that too. And then the last one is painful ejaculation, or if you have bone pain. Listen to your body. Your body is always talking to you. I went walking today. I think I walked a blister on my foot. That's listening to my body. I was walking too hard. But you have to listen to your body. It's your body. You have to understand how your body works.
Yeah, when something's off. You know it.
You really, really do. Here's something else I wanted to here's some more symptoms. Let me see. I did need to urinate, difficult starting, stopping. Not able to urinate at all. That's another one. You go in the bathroom, you feel like you got to urinate, but when you get in there, nothing comes out. That's an issue. So pay attention to that. If you have a weak and interrupted urinary system, where it's weak and you might leak a lot, where you find yourself peeing on yourself, urinating on yourself by accident. So that's something else. Here's another one that I didn't know about. Inability to urinate while standing. That I was telling them about, what was my uncle who used to come up on a motorcycle with his wife?
Your Cat?
Aunt Cat. What was her husband's name?
I forget.
Winnie. Was it Winnie? Well, anyway, he could not go to the bathroom standing up. He would have to sit down to go to the bathroom. So we knew that was the issue in him, because that's not usually normal for a man to go in and sit down to go to the bathroom just to urinate. So that could be an issue too. If you don't find your husband standing while urinate, that could be an issue as well. The next one we talked about, frequent pain or stiffness in your lower back, your hips, or your upper thighs. That could be another sign that there's not enough blood flow. Something is being cut off or not getting enough blood flow to that area. So you got to definitely pay attention to that.
That's a good one.
There you go. So those are some symptoms. So if you have any of those symptoms, you might want to check with your doctor. Get to your doctor. So it also states prostate cancer testing. That's called a PSA test. It's a prostate-specific antigen test, and it is a protein made by your prostate gland. Or you can do a rectum exam. Most men don't like it, but if that's the only way they're going to find out, just get the test done. Just get the test done. A rectum exam can tell if your prostate size or shape or the texture are normal. The doctor's going to put a glove on, he's going to stick a finger, but he's just testing your prostate. It's a must-have test. So if the PSA levels are high or if you have a rectal exam that is not normal, you will need other tests to find out why. You can have a prostate cancer and not have any symptoms at all, like the pastor talked about this morning. But if you have any of these symptoms, please talk to your doctor right away. So the PSA or the rectum exam suggests prostate cancer. You may need a biopsy to know for sure if you have prostate cancer. A biopsy is done with a needle. The needle is placed in the prostate gland. I don't want to scare you, but I'm telling you, tiny pieces of the prostate glands are removed with the needle so they can look under the microscope with it looking for cancer cells. These tiny pieces are looked under a microscope and looking for cancer cells are present. The biopsy is done as an outpatient. It only takes a few minutes. Talk to your doctor about the pros and cons of these tests. So there are some treatments. There's surgery, involves removing the cancerous tumor. You have radiation therapy. I didn't even go over this morning because I was reading from the pamphlet. You have radiation treatment, radiation to kill the cancer cells or to shrink the tumors. You have hormone therapy, has spread beyond the prostate and reoccurred after the treatment. So some of the side effects, these are some of the side effects. Hot flashes, yes, men get hot flashes too. Ladies, yes, they do. Weakness of the bones, loss of sexual desire. Those are just some other side effects.
Right.
So there's something called cryosurgery. It uses an instrument to freeze or destroy the cancerous cells. You have chemotherapy. It kills the cancer cells through pills or injections or through a catheter. Also, biological therapy, use of medication and substances made by the body to increase or restore the body's natural defense against cancer. The next one is high intensity focused ultrasound. You know, they got a little bit of everything right now. This uses an endorectal probe that makes ultrasounds, high energy frequency sound waves, and this can also destroy the cancer cells. Now, before I get into the diet, I want to read this here. This was a study that was done. This came from Harvard University. Nutrition experts have expressed concerns of the hormones in dairy. Dairy products and other growth factors could stimulate the growth of hormones. Sensitive tumors, evidence suggests that dairy could also promote the conversation and the precursorous lesions or mutating cells into invasive cancers. There was a 25% increase in prostate cancer in Japan from dairy. So, prostate cancer that detected early when it is still confined in the prostate gland has the best chance of a successful treatment. Always early detection is always good. So here's factors down here. Overall physical health, lifestyle plays a big role. That's always. You got to stay active, family. Really got to stay active. Maintain a healthy weight. You should know your weight. That's part of knowing your numbers. Your weight, your waist circumference, your cholesterol, and your pressure. Those are the numbers you should know. Also, it says eat less red meat. I said I'm going to do a report on just red meat. You know it. You know it. I bet you they put that fork down then. Eat less red meat and more green leafy vegetables.
Which is what you should do anyway.
Anyway, exercise regularly. Y'all know how I feel about movement is medicine. Don't smoke, and men have to learn to manage their stress. Manage your stress. Now, I'm going to read from these pamphlets that I have here. That was the PSA. We went over the PSA testing and how you get tested. And for the rectum test, we went over that. It only takes a few minutes. Okay, we did that. So now this pamphlet is suffering from enlarged prostate. You can ask about a prostate artery embolism. It's called PAE. You can call the United States Prostate Center. They have a prostate center. This is a pamphlet I picked up from the doctor's office. You know I'm always getting something. The United States Prostate Center, that number is 866-455-3329. And this is, it talks about what is BPH. It's benign prostatic hyperplasia. It's a common condition in older men causing an enlarged prostate gland causing urinary symptoms, including frequent urination, urgent urination, difficulty starting or stopping your urination, weak urine flow, nighttime urination. That's a big one. That nighttime. How many times you getting up going to the bathroom?
Yeah, how about that?
Incomplete bladder emptying. You could go to the bathroom, but it feels like I didn't even go. I feel like I still gotta go. Pay attention to that too.
That seems to be a really big cause. I mean,
for prostate.
For prostate, yeah.
Yeah, that's an early
that's a big
warning
sign. I should say.
Exactly.
Big warning sign.
Over half of men in their 60s and nearly 90% of men in their 70s and 80s experience BPH symptoms. That's benign prostatic hyperplasia.
PPH.
So PPH can also cause pain, inability to urinate at all, blood in the urine, bladder stones, and bladder and kidney damage. So that's why I said one thing can lead to something else. That's why it's so important to know your body. So what is PAE? Prostate artery embolization. And it is a minimally invasive treatment for an enlarged prostate. It offers an effective solution that has a lower risk of sexual side effects such as intrograde ejaculation or erectile dysfunction, and a quicker recovery than surgery. So this is another alternative to the chemo and all that other stuff. So USA Prostate Center offers a PAE performed by an expert, interventionally, a radiologist using advanced imaging techniques. So the benefits of a PAE, that's prostate artery embolization. It's quick and it's easy. It's same day outpatient procedure. It takes about 1 to 2 hours. Resume daily activities the next day. You can't ask for something better than that. I know you're scared. Just go on and get it over with. Just get it over with. So it's minimal side effects. It's low risk of sexual side effects, low risk of urinary incontinence, shorter catheterization time or none at all. Might not even need a catheter. Effective relief, can relieve painful symptoms. So there's another alternative. Now over here it says a non-surgical office based and highly effective treatment for BPH. How does the PAE work? During the prostate artery embolization procedure, patients are given a local anesthesia or a mild sedative. A small tube called a Foley catheter is inserted in the wrist or the groin and guided into the prostate using an X-ray imaging. Tiny particles are injected to reduce blood flow to the prostate, helping to improve urinary symptoms. Most patients begin to experience relief from the painful symptoms within days of the procedure as the prostate shrinks and it relieves the pressure of the urethra.
Mm-hmm.
So there you have it. Why choose the USA Prostate Center? Because I said so.
That's right.
The U.S. prostate
That's it.
centers are accredited for providing high quality outpatient care. Our experienced interventional radiologists use advanced techniques to develop optimal results
for your prostate
care. They're going to take care of you. It's something that they see on a regular basis. That's all they do is prostates. Prostate Cancer Center. That's all they do. Then it says, am I a candidate? If you're seeking less invasive treatment for prostate enlargement with the minimal side effects, the PAE may be the right solution for you. The prostate artery embolization is a minimal invasive treatment for enlarged prostates, offering a relief for urinary and sexual symptoms without severe side effects, and traditionally therapy like sexual dysfunction and retrograde ejaculations. Our experts interventional radiologists will evaluate your condition through a physical exam, including a digital rectal exam, ultrasounds, potentially a PSA test to determine if your PAE is the right treatment for you. So you just go and they'll answer all of your questions. And write your questions down.
That's what I was just going to say.
No question is a bad question.
That's right.
If you're nervous, tell them that you're nervous. You've never done this before. They'll talk and walk you through it. All these locations are in New York. So if you're in the New York area, there's St. Nicholas Avenue in New York. You got Valley Stream in New York, and then you got Bronx, New York. Again, this is the United States Prostate Center. All they do is prostates that I know of in this center. The number is 866-455-3329. Now, we're going to get right into a diet that I recommend for men. A diet is everything.
And again, just want to kind of piggyback on that. She's mentioned it. Write those questions down. Don't get to the doctor's office while he's examining, and then you want to decide on questions. Think about it. Write the questions down. Make them plain. So you can have that conversation with him while you're in the office, and don't forget anything. So write them down. Very important. Okay.
No question is a dumb question.
No question is a dumb question. Please write your questions down. Take that time to get knowledge about what the issue may be.
There you go. So a diet.
Yes.
Diet is everything. And diet mess it up and diet can change it. You just got to flip that and get a good diet in there. Everything that you put in your mouth determines the outcome of your health. Your environment, everything. You got to take your health seriously. We all have to take our health seriously. So a good healthy diet is a healthy diet. Whole foods will provide plenty of fiber. Eat lots of fresh vegetables. That's all those green cruciferous vegetables, your broccoli, cauliflower, all that good stuff. And I know men don't like to eat vegetables, but if it's prepared properly, if you got to get a cookbook and play around with it in the kitchen a little bit, get it to your liking, to your testing, you got to do just that. Your fresh vegetables, and to get your protein from your beans, your fish, and to keep chemicals and pesticides out of your system, try to buy organic when you can. Also, tomatoes. Tomatoes are excellent source of lycopene. Lycopene is excellent for men. Lycopene, it's a phytochemical that has an important protective effect on the prostate. Cooked tomatoes products are actually a more potent source of the phytochemical than the fresh ones. So get you some tomatoes. Get you some spaghetti if it's made properly. Eat up some spaghetti, some Italian food. Okay, pumpkin seeds. Y'all know we always talking about seeds and nuts.
Got a jar of them.
Pumpkin seeds. Pumpkin seeds is a sexual tonic. pumpkin seeds can be just as potent as that little blue pill if you get a handful of pumpkin seeds every now and then.
Do it all the time.
I'm
Take
telling
them
you.
in.
Remember
handful,
them little old men used to always
shake
eat
'em
them
up.
little pumpkin seeds?
Mm-hmm. with
That's
the
why.
shells.
That's why.
Mm-hmm.
But anyway, as a traditional remedy for prostate problems, they are full of zinc. You need your zinc. Sesame seeds are another good nut, another seed that enhance your sexual functions. So pumpkin seeds and sesame seeds are excellent for your prostates, men. So to reduce the swelling, you want to eat cold water fish. Get you some good fish. It's flaxseed or flaxseed oil. Flax seeds, they are high in essential fatty acids, which are known as anti-inflammatories. That can bring that swelling down, bring that inflammation down. Also, green tea. Green tea is a healthy detox. This one drink his green tea.
You heard me this morning,
every
right?
Day.
Got my green tea in my cup.
Every day, every day. But green tea is very, very a healthy detox. You want to drink plenty of good, clean, quality water every 2 waking hours. It keeps fluid moving through your urinary tract. Also, cinnamon is a diuretic. So you can put cinnamon on everything. Put cinnamon in your little water. You can put cinnamon on toast. Put cinnamon in your oatmeal.
Good for you.
Cinnamon is excellent for you. It's good for diabetics as well. So cinnamon, also good for high blood pressure. Cinnamon. Yes, and most people have that in their cabinets. So you want to eat more fish. Now, here's some things you definitely need to stay away from. Like I just read from the what is that, Howard University study about dairy. Dairy is scary. Eliminate all fats from your diet. That's your saturated fats, your hydrogenated fats, partially hydrogenated fats. Yeah, you got to start reading some labels. And they will lead to inflammation and swelling. So that's where that swelling comes from. If you got swelling in your prostates, in the glands, in your testicles, that hurt when you walk, it hurt when you sit down. That could be very painful. The next one is sugar. You got to refrain from so much sugar.
Yeah,
that's
what do they say?
another
The
one.
Weapon of mass destruction
Sugar
is sugar.
is the weapon of mass destruction. It's taking people out faster than a bullet. Yes,
you know how much sugar one person consumes every day? We did a report on that.
Yeah,
remember?
we did. Sugar
Terrible.
wreaks havoc on your hormone levels and it worsens your inflammation. That's why I was watching all of them at church on Sunday. Cake and Crowns. They were sopping up that cake back there, buying up. It was a fundraiser we had at church.
Yeah.
It was a fundraiser.
Did very well.
We did very well with the fundraiser, but I'm just sitting back looking like, look at all this cake. They're gonna suffer. They're gonna suffer for this, for real. But sugar wreaks havoc on your hormone levels. That's men and women. And it worsens inflammation. So if you got any inflammation, refrain from sugar,
Please,
period.
because you're feeding it.
Exactly. The next one is processed foods are
The worst.
full of chemicals that may contribute to your prostate problems. Prostate foods, that would be all fast food, family. Yes, Kentucky Fried Chicken, Popeye's Chicken, Chick-fil-A, all of those are processed foods. Y'all got to stop eating that junk. I'm telling you, y'all got to stop eating that junk. The more people that eat that, the sicker people have become. People are getting sicker and sicker. And
That's
look at
a fact,
look
though.
at the kids.
That's true.
Look at the children.
Yeah.
The numbers are going up in every report that I do because people. I know it's summertime. People want. We live in a microwave society. Nobody got time to cook. We could just buy something.
But just, you talk about, you just think about all
It's
the
terrible.
food, the
It's
bad
terrible.
foods or the franken foods that they're eating. Look at all the different body types you have now because of the industry and what we're consuming these days. These bad, non-nutritious foods, and it's changing the dynamics of the bodies. The bodies are going through a metamorphosis, it looks like, because they're trying to adjust to all this fat that's increasing in the body. And it can't get rid of it.
And
it's
then
terrible. It's getting worse.
and then you don't even know what they are pumping into this meat.
You have no idea what
now
you got.
What you
3D
call it?
food.
3D meat,
3D.
manufactured meat.
Yeah, you got so
they
many
can
things
take,
out
and
there.
then some of the meat they're saying is human meat. We don't know what they're
don't
putting
know.
in
We
this
don't
meat.
know.
That's why I said I got to do a report on just
You don't
red
know.
meat. So everything that you're ingesting in your body, if it's not compatible for your body, it is going to make you sick. We got to get back to the things that God put here for us to
Mm-hmm.
ingest so we can live to the ripe old age. The further we get away from what God put here for us, the sicker
Thinking
we
we
have
got.
become.
Mm-hmm.
That's the truth. So processed foods full of chemicals. So stay away from processed
Mm-hmm.
foods. Also, avoid alcohol and caffeine. I know y'all heard about Starbucks, and I'm just going to say it. Starbucks is being sued because those some of those chemicals that's in that coffee is carcinogenic.
Mm.
I mean, carcinogenic and can cause cancer. That's a lawsuit that's in process right now. Those coffees. So be mindful of where you're picking this stuff up.
Mm-hmm.
Last week I did a report on microplastics. And I hope everybody got to watch the program, the Plastic Detox on Netflix. You got to watch it. But they were even saying the plastic cups, the cups that people get a cup of coffee every single morning, got to have the cup of coffee. The lining of that cup is plastic. So you're ingesting plastic every single day. So how much
Mm-hmm.
plastic do you have in your body? That could be due to prostate. We don't know
No,
where
no,
all this coming
exactly.
from. So it's a
Exactly.
build up of things. Not just going to get it overnight, but it's a build
And
up
that's the
of
thing,
things.
some men get it, but like you said, 313,000 this year. Some gonna get it and some may not. The question is, why are so many people getting it?
And the age is getting younger. They're
Yeah,
talking
why?
45.
45 now.
45 with
45.
prostate cancer.
Even for colon cancers now, what, below 38 now? Something like that?
And
In the
yeah,
30s
even
now.
the late 20s, early 30s for
I mean,
colon cancer. You
something's
gotta pay.
definitely going on. You
Something's
gotta pay
going
attention.
on. That's why we
Yep,
do this Awareness Wednesday,
yep,
just to keep
yep,
you aware,
yep,
make you
yep.
sit back and go, Somebody's always sending me something on meat,
Mm-hmm.
on some kind of processed meat, or how they make
Yeah.
hot dogs, or what was the other thing I just sent you?
Which one? Oh,
Sausages.
yeah.
Sausages. They're saying that they're made of frogs. They're raising frogs to make sausages. We don't know what's all
You
in
have
this
no
meat.
idea.
If you're not manufacturing it yourself, or you got
Yeah.
the
You just take,
factory
it's like
right
Russian
next
roulette.
door,
You're taking a chance.
you really are.
That's why you want to eat foods you can recognize.
You can identify,
Define.
or you grew yourself.
Exactly. That's what you should be consuming.
Exactly. So the sooner that prostate cancer treated, the better your outcome results.
Mm-hmm.
So if you know your body, you feel something out of the ordinary, just get it checked out. You don't always have to go the traditional way of what they say. We are not doctors. We're not telling you what to do, but look for a natural alternative. There are natural alternatives out there. And you got to remember, 100 years ago, half of these diseases didn't even exist at all. So where's all this stuff coming from? So they'll feed you the junk, and then they'll give you the it's crazy, y'all. But here in our company, we have all natural products. All natural products. So these are some products that I chose for that may help with prostate.
Oh, let me bring up the screen.
Yeah. But it's oh, I ain't even look back here. Oh, here we go. Colleagues reported increasing incidence of prostate cancer in men ages 20 to 49. 20
Wow,
to
20 to
49.
49. Look at that.
That was in
20 to
1991.
49.
So now we're in 2026. 20 to 49? Come on. 1 in 8 men. They said 27,000 men are living with prostate cancer right now.
Mm.
The average age is 66. It begins at 50. African American men are more prone to it. They have the highest rates of it. Diet shows suggest that men who eat a diet high in animal fat or meat may be at increased risk. Just reading you from the back of the book. It is also one of the most treatable types of cancer. Let me read that again. It is also one of the most treatable types of cancer with high survival rates. While the screening process is often quick and painless, many are intermittently examined and therefore put it off. Most men are intimidated. So don't be intimidated. Just get the test done. Just get the test done. So here in our company, artists, we have some all natural products. I picked 4. Actually, I picked 5. I did the Fantastic 4. That's the red, yellow, and the green.
And the shield.
And the shield. The red is very high in antioxidants.
Very good.
That's the report talked about your fish. It's high in antioxidants. Your omega-3s are in our red Levine. No, not it's the red. It's in the what's the name?
Is it up here?
Omega-3s. I'm mixing the products together. But our red Levine are berries. It's all berries.
All the berries are in here.
And they're all red berries. So things that's red get lycopene, like the tomatoes.
Exactly.
So that's high in antioxidants. Very good for you. It can also bring down shrinking. Then you have the green. The green is a daily detox. What goes in has to come out. Like I said, if you don't have that good blood flow or that good flowing through your body, it's going to be some backup somewhere. Most people are sick because they're constipated. They just got some type of backup somewhere. They need a release. They need a enema. They need something. So that was me. I kicked this. But they just have to get things moving. So that's what our green Levine for. It's vegetables and it's herbs. All natural. And everything tastes good. Then we have our yellow. That's a multivitamin. So if you give your body the proper nutrition and the proper waste removal, your bodies can heal themselves. And long as your body stays in an alkaline state, when you get your body in an alkaline state, 7.5 or higher, no disease can live in an alkaline body. This is why
it's hard for it to live in an alkaline body.
It's hard, exactly. Yes. Very, very hard. Then we have the cran aloe. That's what Pastor Massey talked about this morning, was the cran aloe. He said his PSA test was high, and he just started drinking the cran aloe, drinking the cran aloe, drinking the cran aloe. And it took his doctors by surprise that his numbers was going down. He said, whatever you're doing, keep doing it. So he drank the cran aloe. Then we have the shield. Shield also has zinc in it. Zinc is what's found in them pumpkin seeds and them sesame seeds. So we have it in our shield. So you want to get a good source of zinc in there as well. And that's an immune booster because it also has an elderberry, another berry in it, which is absolutely fantastic. And then we have our omega-3, 6, and 9. That's the fish oil that I was rushing the gun on. But the omegas, like the report says, get a good source of fish. Omega-3, 6, and 9 is a good source of fish. It's good for your body from head to toe. It's going to take care of everything. For your joints, it's for your brains, it's for your heart, it's for your blood, it's for everything.
And your omegas you can get from the fish, you can get it from nuts. Also, you can get it from some fruits and berries.
Right.
Omegas, which is very good.
And then the last one that I threw in there would be our pure noni. Because if you're having prostate issues and you can't go, there's a lot of pain. There's a lot of backup. There's some buildup. So there's a lot of pain in there. So the pure noni is our pain reliever. It's like an ibuprofen. It has a strong taste to it, but it works. It really, really works. So these are just some natural products that we use on a regular basis for just about everything. It's the same products we talk about every single week with every topic that I cover. And y'all got to hear some of these testimonies. It will blow your mind how these products are helping so many people come off of medication, revert their issues, back to normal. But the bad thing about it is once people start feeling better, they stop taking it. That's where people mess up.
And it happens all
the time. You revert back to what you was doing before, and then you keep doing what you're doing, you're going to keep getting what you're getting.
Exactly right.
So that's why we do these reports. It's just a reminder on what you should be doing. You know what you're supposed to be doing, but you're not doing it.
Right.
So we just here to remind you, to help. And all we do over here in this company is use, share, and inspire others to do the rest. If I could get somebody off of medication, I'm a happy camper. I'm a happy camper. Yeah. But in the meantime, Reggie and I, we over here just aging backwards, just because. Just because we just aging backwards. We be fighting over the products. You taking too much. No, you taking too much. But it is what it is. It is what it is. You don't have any of the coffees in this sketch. But we do. We also have healthy coffees as well. We got a Nutri-Shake. That's a meal replacement.
So
you can't get you can't. You know, you can't get all of your meals in there. So get your shake. Do a shake in the morning. You could do a shake in the evening. Your biggest meal should be lunch. High noon, lunchtime should be your biggest meal. Eat up, because you got all day to burn that off. And then at night, around 6, 7, when you're supposed to have dinner, have a shake and a glass of water and go to bed. Just do it. You'll feel wonderful. But cleanse your system. We have an ultra body cleanse. That's a detox. Cleanse your system. With so much going on right now, y'all, with all these chemicals that's in our food, all the what is it? The pesticides, herbicides, insecticides. It's so much that they're spraying on our food. That's what's breaking people down too. So we have to detox our system quarterly. We got to do more of that to just sweep some of these things out of our bodies. Heavy metals. You got we got so much stuff in our bodies. We just need to detox on a regular. So those are some of our products that we have. Whoever invited you, get back to them. Get involved with these products. Do you have to take everything? Absolutely not. You do not.
Take everything.
Start with the Fantastic Four.
I was going to say that. Start with the
Fantastic
Fantastic
Four. The red, the
Four.
yellow, the green, and the shield. That got you covered.
And
it
use
just got you covered.
That's
and
all
use
your power right there.
And then when you get some results, call us and say, y'all, you know what? That stuff really worked. I know.
And don't take our word for it, but use the product and see
it
for yourself.
But that is it, family, and I hope you got something out of it, because prostate cancer is not going anywhere.
And getting the products too, the key thing is that your body needs time to change from what it was to where it's going.
120 days
at
when you get
minimum
new red
120
blood
days.
cells.
So you want to get these products and stand it for a good consistently for at least 3 months and start seeing the results. But as you're going through that process, make sure if you're seeing your doctor, getting your results, get your blood work. Look at your numbers.
Look at your numbers.
Look and see what's changing, so you can see the results that you're going to have as you move forward in on that fast track to getting healthy. So let's do that.
And that's where we are, family. Yeah. This is just awareness, just to wake people up, keep you aware of what's going on.
Indeed.
I find my information from everywhere. I watch movies. I do videos. I do YouTube. I do, what's the other one? My Netflix. My movies on Netflix. I got a library, an arsenal of library books in my office. You ask for something and I got it. I can look it up.
Absolutely.
Always ordering a new book. But watch the Plastic Detox. That is a must-see movie. It'll just really open up your eyes.
That was on YouTube.
That was on Netflix.
The plastic one was?
The Plastic Detox was on Netflix. It's an eye-opener. We have to do better, family. We truly have to do better, especially for the kids. They're saying our younger generation are not going to live as long as we are. Because look at where they are. You got colon cancer is on the rise. That's hitting them in their 20s. Colon cancer. Plastic buildup. That was another one. Watch the Plastic Detox, because it's about some couples trying to have children and they can't. So they had to detox their homes of plastic. You'd be surprised how much plastic is in your home.
Shoot, got a lot of plastic.
Everything is plastic.
Cups, bowls, everything.
But there's other alternatives. You don't have to go that route. I mean, it's something to do. It's an adventure to take. But we did the report on, what was the hormone disruptors. So we're changing some things already, hormone disruptors. So there's some things around your house you really need to get rid of. It's spring cleaning. Just throw it out. Just throw it out. So we got to get back to the things that God intended for us to have, for us to use, for us to eat. We got to get back to that. So that is going to complete our report on prostate cancer. Next week, we're going to talk about gout. Gout is another one, and that's also on the rise. And I hear that can be extremely painful.
Oh, I'm sure.
So there's a lot of men right now with gout. You can't put a sock on, you can't put a shoe on, you can't put a sandal on.
And it's crippling.
Very much so. So tune in next Wednesday. Bring your daddy, bring your uncle, bring pop, bring grandpa, all of them on gout next Wednesday. So this is our YouTube channel. Follow us, the
On
Power
YouTube.
Couple of Health on YouTube.
Mm-hmm.
All the segments I have done are on YouTube.
Yeah, they're posted right there. So if you're not already subscribed to it, please do, and forward it and share it. And a lot of information on that platform. It really is a lot of information. Great reports. You can always go back and watch it as many times as you like. It's there
But
for
what
your,
you
for
won't
your
find
educational
there
reasons.
is the reports I
Yeah,
did
that
on
one you won't see.
hormone
Disruptors, you won't see that.
I did that. I think I did. It was the whole month
Yeah.
of April.
Mm-hmm.
And
You
the
won't see that
reason
back
why
there.
I did not record those because I was calling off
Names.
product names that are toxic and to us, to our families. So I didn't want to put that out there because
No.
I didn't want nobody coming after us. But it's some things that's in everybody's households that's making you sick and you have no idea of what it is. No idea at all. So that's what this platform is all about. So those reports you have to catch in the morning
Yes.
because those are not recorded. So you have to catch it live in the morning. So with that being said, that's going to be it.
Yes.
Anything else you want to
No,
add
just
there,
want to
sir?
say a thank you for those who have joined us this evening to be on this Awareness Wednesday. We truly appreciate you. And
Absolutely.
keep, for those who keep supporting this platform, we thank you. And just to let you know, we are off. You want to mention for our summer.
Some
So we
June,
only
July and August.
Yeah, so we only have maybe another couple of segments to do, and that will be it for the summer. We'll be taking a break on that.
For our
Okay.
6 o'clock p.m.
Indeed, we'll have the morning session, but not the PM session.
Right, because they be jamming in the park on Wednesday. And
Yeah.
that's where I'm going to be jamming in the park on Wednesday. We'll get back at you. But
All
we're
right.
still here for you,
Yes,
family.
we are. We
If
are.
you want us to look up anything, give
Please
me,
let us know.
shoot me on DM and I can look that up for you.
Absolutely.
But other than that, we love you and there's
nothing you can do about it. Thank you,
Mwah.
everybody. Truly appreciate you. Have a
Absolutely.
great rest of your evening, and we'll see you on the next Awareness Wednesday. Don't forget, gout. Who do you know? Let's do this.
There you go.
Bye for now, fam.
Good night.